pupils are meotic and irregular in shape, light and test accommodation are done. Now see this. These are 3 pictures they have given, right? Now if you see here, this I think is your normal one, and then they are giving you the light reflex. So when I am putting the light, can you see it is absent? So light reflex is absent here, both the direct as well as indirect. But when the person is doing the accommodation reflex, can you see the size of the pupil is much smaller? So accommodation reflex present. I think now it's very, very simple. Where do you get the light reflex absent in both the eyes? Accommodation reflex is present, and therefore the pupils are meotic and irregular in shape. What is this called as? This is called as the Aggarwal-Robertson pupil, right? This is called as the Aggarwal-Robertson pupil, which is also called as the ARP, and that you can also remember it as accommodation reflex present. So what happens in cases of Aggarwal-Robertson pupil? We have got the lesion of the pretectal nucleus. We have the lesion of the pretectal nucleus, and we know that the pretectal nucleus is involved in the light reflex, not in the accommodation reflex, and that is the reason why light reflex is absent and accommodation reflex is present here. So we have to see all of the following are the causes of these pupil. What are all causes of Aggarwal-Robertson pupil except diabetes mellitus? The very first is incorrect. We do not get Aggarwal-Robertson pupil in diabetes. Multiple sclerosis, pinelomas, iridocyclitis are the ones. So answer will be your diabetes mellitus. I think purposefully we have kept this diabetes in the first because whenever we have some abnormality, the first thing we are thinking is the diabetes. And diabetes is not the cause of the Aggarwal-Robertson pupil. Once we should revise the pathway of the light reflex also, so that it becomes very, very clear. Pathway of the light reflex. So what is the pathway of the light reflex? Obviously it will start with the light. The pathway of the light reflex will start with the light. It will go to the afferent nerve, that is your optic nerve. From the optic nerve, this will go to the optic tract. Okay? Now from this optic tract, it will go to not to the lateral geniculate body, rather to the pretectal nucleus, which is actually anterior to the lateral geniculate body. And from this pretectal nucleus, now it is going to 2 sides, that is EW nucleus of both the sides. And we know that the EW nucleus is of 3rd nerve. So this is going to 3rd nerve of both the sides. From the 3rd nerve, it is going to the ciliary ganglion of both the sides, and from the ciliary ganglion it is going to the muscles. So we have got the sphincter pupillae muscles of both the sides, and that is why whenever you are putting the light even to one side, it is reaching to the pretectal nucleus and then it is sending the impulse and the innervation to both the sides, and that is why I am getting both direct and indirect. Now what happens in the accommodation reflex? Everything is same, but except for this pretectal nucleus, we have the lateral geniculate body. So if I have the lesion of the pretectal nucleus, which is happening in cases of Aggarwal-Robertson pupil, I will have the absence of the light reflex, but accommodation reflex will be fine because that includes the lateral geniculate body. All right, now it's very, very clear.